Hey everybody, and welcome back to my channel. Today we're going to talk about anorexia. Anorexia nervosa, shortened down to anorexia, is an eating disorder that involves very low body weight, fear of gaining weight, and the use of extreme behaviors to stay underweight. Many people who have anorexia strive to be thin by severely restricting food intake, nearly to the point of starvation. Others exercise excessively, use laxatives, or intentionally vomit in an attempt to lose weight. Despite being underweight, those who are viewed with anorexia are often viewing themselves as overweight, even though they are underweight. So I'm going to provide you an overview of the disorder, including anorexia signs and symptoms, frequently asked questions, and basic information about treatment. And I'm going to introduce you and your families to the topic of anorexia, and I'm going to provide you with some basic psychoeducation behind the matter. So stay tuned. Okay, so here's some signs and symptoms of those with anorexia. So everyone's experience with anorexia is unique. Diagnosis should only be made by a qualified professional. So here are the primary symptoms: very low body weight, distorted view of body weight or shape, failure to see low body weight as serious, intense fear of gaining weight, self-esteem dependent on weight, excessive dieting, exercise, or binging and purging. Other signs and risks are mood swings, increased risk of suicide, heart and organ failure, amenorrhea, which are menstruation stops, depression, anxiety disorders, growth of soft hair on face and body, skin discoloration, obsession with counting calories, and reproductive complications. Okay, some frequently asked questions. Well, who develops anorexia? So anyone can develop anorexia. It's about 10 times more common in women. Anorexia also has a genetic component, meaning it runs in families. Another frequently asked question is, when does anorexia begin? Anorexia usually begins during adolescence or young adulthood and is often associated with a stressful life event, such as going away to college. Another question is, can anorexia be treated? Anorexia is difficult to treat and relapse is common. However, when anorexia goes untreated, it tends to be worse and worsens over time. Most individuals can achieve remission within 5 years. Last but certainly not least, we're going to talk about treatment. There are treatment providers, levels of care, and then treatment goals. So treatment providers may include mental health and family therapists, nutritionists, and medical doctors. These professionals collaborate to treat the medical and mental health components of anorexia. Then there's levels of care. So depending on the symptom severity and duration of illness, treatment may take place in an outpatient, day program, or hospital setting. A person may transition from different levels of care, sometimes multiple times. And then last but certainly not least are the treatment goals. Initial treatment goals are to restore a healthy weight and treat physical complications. As treatment progresses, goals focus on underlying issues such as improving body image and establishing healthy eating habits. Alright, so that was it for my anorexia quick upload today. Anorexia is a very, very serious disorder to have. I would really suggest talking to a mental health professional or another professional who can diagnose you correctly. There is no medication management for a type of disorder like this, but definitely having a support group or maybe a third party looking in will definitely help you gain the perspective that you might need that's outside of your head, outside of the box that you might need. But it's definitely something serious to keep into consideration. But anyways, I hope you guys liked this video. If it was helpful, if it was not, comment down in the comment section. And thank you guys so much. Have a blessed day. Mwah.